Have you had any injuries, any traumas?
Well, I'm sure when I tumbled down the mountain one time, that probably didn't help.
Okay. A little bit of a push just like that. Nice job.
Is it okay if I make noises?
You can do whatever you want. There it is. Hey, yo. So let's talk about what's going on, okay? Because I know we had the lower back, right? Can you show me where exactly the lower back pain is? Right into the center?
Usually right in here.
So right into this area right there.
There.
Okay. So this has been going on for how long would you say?
I'd say a couple of years.
Okay, so it's been a little bit of time.
Yeah.
Have you had any injuries, any traumas that you can remember that related to the lower back?
Well, I'm sure when I tumbled down the mountain one time, that probably didn't help.
Okay.
But I broke my nose and my wrist.
During that fall?
Yes.
Okay.
Yeah.
How long ago was that?
It was about 10 years ago.
10 years ago, okay.
Yeah.
Well, looking at the x-rays, I mean, you definitely injured the back, and it's whether it be 10 years ago or maybe longer, but it's definitely been there for some time.
I do a lot of hiking and biking and snowshoeing.
Pretty
so
active, okay.
Very. So
Good.
it's not because of my age that I've injured myself, and that's what they always think, oh, you got,
Right.
it's old age, but it's not.
Yeah.
It's because I'm active.
Yeah.
And I've fallen off of my bike before because of flipping off of,
And I will tell you too, because sometimes there's two issues, right? A lot of times things wear out and people start getting into pain and injuries, and then they stop doing activities. They become less active. But many people, if you stay active and keep moving, that's actually better for you, just because one, like if you don't use it, you lose it, right? So you start losing muscle tone, you start losing bone density. So the less active you are, the worse you get. And so sometimes it's almost beneficial for us to, even though we have some aches and some discomfort, to still be active because it helps to keep the rest of your body healthy. But we still get some other issues still in the spine, which we can tell it's been kind of wearing out a little bit, okay? So in terms of the lower back, I can definitely tell down in that lower back area, we are seeing what's called a retrolisthesis. So basically, you only have 4 lumbars. Typically, people would have 5, but your body, sometimes the bodies will develop where they only have 4. Some people might actually have 6. That's why we do x-rays, because I don't ever want to guess on your spine. I want to know exactly what's going on. So when I go into work on your body, I know what I'm doing. I know what segment I'm on. I don't want to ever guess on your spine, okay? Right on over here, this joint, essentially the bones should stack right on top of each other. Your L4, right on top of the sacrum, it's slipped back. And when it slips back, you only have so much space for that nerve. When that nerve gets, basically we call it encroachment of the nerve, that space gets smaller because as that bone shifts back, it pinches down where that nerve's supposed to be at, okay? So what we're gonna be looking at, if the inflammation, the irritation, when we do the measurement, it's gonna be in that lower back area, we're gonna work on trying to open up that space so then that nerve can start to flow freely here, okay? So every time you come in, we're gonna pull up those x-rays so I know what's going on, but we're also gonna scan you with this tool just to measure some of the inflammation that's going on in the spine as well.
Is there any impulse or any
just
kind of
reads
electric or anything that goes in the body?
It only reads the information.
Okay.
It doesn't emit any information. Okay? So you're okay.
Thank you.
Yeah, my pleasure. All right, and I understand that you don't get really much neck pain either, correct?
Correct.
Okay, so that's where you're seeing. So we do got some pressure. Up in the neck, we do got some wear and tear on the joints too. I know you said that you've taken some tumbles on the bike as well. Yeah, I'm so impressed. I'm so happy that you're so active. That is such a cool thing. I'm gonna press onto the spine here. Here's 7, here's 8, and then 9. Any pain or soreness there? 7,
A little bit of soreness.
8, 9. Which is the most tender?
I think 7 might
7, the one a little bit higher there. I'm gonna touch you to the left side.
Okay.
That side moves much better this way, actually. Right here is where it gets, that's where it gets locked right there. So the joint, as you're moving to the right, that joint should move this way.
Okay.
But when I'm moving you this way, that joint, it just gets jammed. It's not going where it's
Yeah, I
supposed to.
felt like it locked up.
Yeah, so we got that T7 here. Let's take a look at that L4 down below just to kind of see how that's moving. Is that sore right there?
Yes, it is.
Yeah, I'm gonna move up a little bit. 4. Okay, this is 3.
Yeah, 3 is not like 4.
But 4 is right.
Yeah, that's
Okay.
like sore pain.
All right, let me tilt you over to the side here. Relax in there. Yeah, that's
Am I
where it
doing
gets
it
stuck
right?
there. Yeah, you're doing just fine. All right, let me take a look at this neck here. 6, 7. Which is most tender? Would you say 7?
I'd say 7
Yeah.
is tender, but 6 is too, but not as much as 4 or 5.
6,
Yeah.
7. I think we're gonna go with 6
They
there.
might be the same.
Yeah, because what I'm doing is when I rock your head back and forth, that joint should glide back like this. When I rock your head on 6, it kind of just gets stuck a little bit more. We should expect to see more mobility. So C5 would have the most mobility. 6 should move a little bit. 7, there's not as much, but 6 does not move as much as it should be doing. So that's what we're going to do today. We're going to go with C6. We're going to go your T7, and then we'll go down to that L4 on the very lower part of your back there, okay? So have you been adjusted before? This is the
Never.
first time. Never. Wow. First time for everything, they say. When we go ahead and adjust your spine, when that joint and your spine, it's kind of shifting back like that, and then it kind of shifts and moves depending on the direction. We're going to contact that joint. I'm going to shift it forward just to kind of get it back into position here, okay? Now you might hear some poppy noises. Every joint in your body has some gases in there. So whether it be your knuckles, your toes, your knees, your spine, when we shift those joints, the gases get released, and that's why you might hear the poppy noise, okay? So let's see how we're doing here. Let's get that C6 here. Relaxing that chin over to the side here. Now your job is just as challenging as my job. It's to relax here, okay?
I'll try.
Yeah, so just take your mind. Do you like going to the mountains, the beach?
Yes, all of it.
Where's your favorite place?
I love all the beach and the mountains.
All right, well, let's go to the beach together, okay?
Okay.
Take your mind there and listen to the waves crash and the wind blowing, the sun hitting your face. And just let your body relax. Let that shoulder go. Let it go. And a little bit of a push just like that, okay? Last one. There it goes. Okay.
Yeah,
There.
that was great.
Yeah.
I can tell I can feel so much better.
Good. Well,
Can I do that?
yeah,
Just
that's fine with
normal
me.
movement? Oh,
Yeah.
yeah. Oh.
All right. Now the same thing is true, just like with your neck. Sometimes that can have a lot of scar tissue. So we're gonna go nice and easy, nice and light first. If it moves, great. If not, we might need to just go a little bit more force in there, okay? But you'll be just fine. Right on over here, giving a little bit of a push, just like that, okay? Relaxing that shoulder. There you go. A little bit of a push, just like that. Nice job.
Is it okay if I make noises?
You can do whatever you want. You can
Be a
scream,
baby.
you can shout. If you cry, that's okay too. Come on up, let's have a seat. Go ahead and stand for me. You're gonna walk that way. How are you feeling? You doing okay?
Yep.
Good. One more time back over here. We're gonna meet you right on over here. So we're gonna go get this mid back right on over here. 1, 2, 3, 4, 5, 6. Deep breath for me. Let it go. Relaxing the shoulders. A little bit of a push, just like that, okay? Again, all the way out. Ooh, good job on that one.
Am I walking too fast? This is my normal pace.
You walk really fast.
I'm
Really
sorry.
fast. That's all
You want me to
right.
go slower?
Whatever you're comfortable with, I'm okay with.
Okay. Well,
Yeah.
you said walk, so.
Yeah, walking's good.
I was married to a man 6'5".
6'5", you gonna catch up with him, huh? That's awesome. All right, so just sitting here, how are you doing? You doing okay?
I am.
Good.
I kind of feel relaxed,
Good.
but I have to tell you,
Mm-hmm.
I've never gone to a chiropractor because just was always afraid of all that.
The popping, the twisting, the cranking on the neck.
Yeah, and so now that you've done that, I think I'll be a little more comfortable
Yeah.
because it really was not painful. It was just a shock.
Right.
The force.
Yeah, that is the best explanation of what you just said. You know, a lot of times when people get, you know, they're screaming, shouting, and on any of the videos that we see online, whenever we do the adjustments in our office, a lot of times it's not because it's painful, it's just more of like the anticipation, the shock that happens from the adjustment. But most patients will tell you that it's actually not that traumatic. It's pretty easy. Especially the force that we try to do for the adjustments. We try to go as light as possible. Sometimes we do need to go a little bit faster in terms of the adjustment, but we do try to go as light as possible, depending on also the patient too. You know, if I have a 6 foot, you know, guy, you know, however many pounds, it might need to go a little bit more force than, a little baby, So it just depends on the person, the patient, the condition of what's going on. But you did so well. I'm so proud of you.
Oh, wow. Well, thank you.
Yeah, that lower back's looking really well. Well, the biggest thing is over time with the adjustments, we're going to see how your body does. There are some patients that are like miracle patients. We get the adjustment, boom, and they're like, oh, I feel so much better. Sometimes, for most of our patients, I will tell you, it's a gradual process. I mean, it depends on how long the problem's been there for. But many of our patients, they've developed pain over the years and years and years of just wearing out their joints. So it does take some time for that body to receive and accept the adjustments and to hold those positions as well. So we'll see how long and how well you'll do. But in regards to your body, you got some great things going on in terms of the adjustment. It can feel a little soreness just because we got some joints to move in there. So ice is your best friend. 15 to 20 minutes, get an ice pack, put a paper towel around, ice those areas if you feel sore. If you don't feel much soreness, don't worry about it, but if you do feel sore, ice is the best thing, okay? The second thing is you're very active in terms of your activity, continue that, but just listen to your body. Walking is usually what I'll tell patients is the best form of exercise.
Sure.
So if you can do 15, 20, 30 minutes of walking, that's going to be excellent. I imagine you probably do more than that.
Do at least an hour and a half.
If you're used to it and your body can handle it, go for it. I think that's a good thing. You are all set for today.
Oh,
you
great.
did so well.
Thank you.
I'm so proud of you.
Thank you.